Hi, I'm Dr. Martin Rutherford. I am a chiropractor, and more pertinent to our topic on vitamin D today, I am a certified functional medicine practitioner practicing here in Reno, Nevada, in the foothills of the wonderful, beautiful Lake Tahoe.
Yes. Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
So Dr. Gates is a functional neurologist. He works primarily with the brain and nervous system and all the chemistry that relates to that. Functional medicine is an alternative way of looking at the physiology of a variety of different common diseases that we have out there. Putting the two of these together, we have developed a chronic pain practice that gets more interesting by the day. And we have a heavy bent towards neurology because of Dr. Gates's background, and we seem to attract a lot of fibromyalgia, peripheral neuropathy, chronic fatigue, restless leg syndrome, dizziness, vertigo, balance. We find that a lot of the problems, even related to thyroid and even related to gut, particularly intestines, stomach, those types of things, have neurological components to them, which, if they're not ultimately handled, create chronicity in them. You're taking herbs, you're taking botanicals, you're doing cleanses, you're doing all stuff. It gets better, then it doesn't, gets better, then it comes back. Usually there's a big neurological component missing in your therapy. And in all of that, we have seen several consistencies among our chronic pain patients. And one of the consistencies, interestingly enough, this topic came up at great length yesterday in the lady who was here from St. Louis. And it was vitamin D. The consistency that we see is invariably when patients come into our clinic, their vitamin D isn't low. It's like in the toilet. It's like abysmal. First of all, the vitamin D it ranges what, 30 to 100, something like that.
Basically, yeah.
So, and that's probably too wide. Would you agree?
I would agree.
Okay. So, but even in 30 to 100, we have people coming in here with vitamin D levels of 11, 15, almost non-existent. And I was chatting with Dr. Gates this morning, two of the commonalities that are there. We're going to discuss it in much greater length. Two of the commonalities that I see, and I'm doing the intakes, and so I get to kind of see the patterns and stuff, is all of our patients have autoimmune problems. Most all of them have kind of post-traumatic stress syndrome, and most of them have bad guts. A lot of them come here for that. They come here specifically because they have bowel problems and they haven't been fixed. And they don't have low vitamin D. So we're going to discuss that in greater length, because when you start looking at things like stress mechanisms and the immune system, which we're going to be talking about, that can affect a lot of things. So vitamin D, usually if you look on the internet, it's going to say something about you need to get sun. We've had people in here who are lifeguards who had low vitamin D. So we'll discuss that a little bit. And low vitamin D seems to be understood to help absorb calcium. It actually helps absorb a lot more than that, and it usually takes place in the intestines. We'll talk a little bit about that and more. So we're going to talk about, and we probably should talk about people who store vitamin D. I didn't see that if that was in here, but I get that. Right. I get that question occasionally. Like my doctor told me I could take too much of it. So we might want to address that too. So vitamin D, why you need to make sure that your vitamin D levels are normal and way higher than 30, the low end of the spectrum. Maybe I'll share with you my experience on vitamin D. So vitamin D, more than just a vitamin. A lot of times people are shocked when I will say, well, it's actually kind of a steroid hormone.
Well, and
I'll let you go from there.
All physicians, nutrition majors learn vitamin D from the perspective of bone metabolism, as Dr. Rutherford was saying, how vitamin D is very important in bone development and maintenance of good bone architecture and density. In essence, going through the overview of vitamin D, vitamin D causes the absorption specifically of calcium. As Dr. Rutherford said, it can cause absorption of other minerals, but especially calcium is highlighted so that our calcium levels can be elevated in the bloodstream so we can make good bones. But it's very interesting. A lot of people don't realize that vitamin D actually metabolizes calcium from bone tissue as well. And then it's thought through that process that once you have an abundance of calcium in your bloodstream, that then you can make more bone again. So in essence, vitamin D is learned from that perspective. But as we're progressing into 2016, just more and more information is coming out about the importance of vitamin D. A lot of people started talking about it, gosh, back in 2005 relative to MS, multiple sclerosis. We're going to highlight that today in our broadcast. We're also going to highlight several other features of vitamin D metabolism, how it's important from metabolic diseases to autoimmune problems to just generalized immune function and battling infections.
Okay. And I tend to think in more kind of broad strokes of like you were painting a wall and there's like all these broad strokes. And Dr. Gates tends to think more in filling in all the little cracks that we missed over there. Okay. And but one of the broad strokes about vitamin D is we're going to present, and we probably certainly don't know everything about vitamin D at this point, but what we know and what is known, you're about to find out. But understand, we are beings who live in a certain environment. We live in gravity. Gravity has a certain effect on us. We are supposed to be relaxed. We're supposed to be in a kind of a calm situation. We don't live in an environment that's calm. So it's because our nervous systems are not congruent with the environment, that creates certain effects. And one of the things is we were made to live in the sun. I mean, the sun is life. So it's not surprising that the sun creates the mechanisms that create the vitamin D in our system, and that it has such an amazing plethora, a wide range, numerous, multiple types of effects on our system. And all that's happening is we're saying more and more and more how much vitamin D is important, to the degree where we try to give our patients as few supplements as possible. When we're done with a patient, we want them cleaned up, we want them educated, we want them to have as few supplements, no to as few drugs as possible, and the ability to manage their cases themselves. I would say consistently our patients need to take vitamin D.
Consistently.
It's pretty like, it's like
a rare.
It's like one of the only two, I used to say we only had one consistent recommendation to patients, and I'm not going to tell you what it is because you're going to go out and do it and then tell me it doesn't work. And then, but the other one would be vitamin D. I mean, it's like everybody comes in here needs vitamin D. And we do neurological work and we do immune work. That's really what we end up doing here. And so vitamin D, huge, just huge. So is that why we assess it in all of our patients, or why would you want to give them a little bit more specificity?
Yeah, I would say
we assess it in all
most of our
patients.
Most of our patients have autoimmune problems, as you're saying.
You come in here, you're getting tested for vitamin D.
Exactly. And with autoimmune disease, there's something called a Th1, Th2 balance. Now, we have doctors and we have the lay public watching these broadcasts.
We're going for the lay public here.
Right, but I'll just give a little background there for the lay public. Don't do a
doctor presentation.
So relative to Th1, Th2 balance, there are two basic sides to the immune system. One side is called the Th1 side, and it's like the Marine Corps. And they do the mono-a-mono combat, you can think of it that way, of bacteria and viruses.
Mono-a-mono, for those of you who don't know Italian, means hand-to-hand combat.
And then the Th2 side does more the precision killing of the bacteria and the viruses. It remembers bacteria and viruses. And it's more like the Air Force. Exactly. You got it.
Doing bombing, precision
killing. So
drones.
That's the Th2, Th1 balance. And we want them to be in balance. However, we find with a lot of autoimmune diseases, allergic diseases, that there's an imbalance, and one side can be too dominant. What we have found in the scientific literature is that necessarily bolstering up the weak side does not help individuals.
We have found that in practicality too.
Yes, we have.
And I got sick for about 2 months by bolstering up the weak side.
Yeah.
We experiment with me.
And just as Dr. Rutherford was saying, that it's a more complicated situation than just bolstering up one weak side of your immune system. However, the one thing that does seem to consistently work and is being discussed within the immunology field is the use of vitamin D to fire something called the Th3 regulatory system. And the regulatory system, the Th3 one, which is mainly in your gastrointestinal tract, helps to bring balance between these two sides of your immune system. So that's the importance of vitamin D in the assessment of pretty much any autoimmune patient.
So if you have these two sides of the system and they're not in balance, let's say because you have an autoimmune problem and they're continually trying to keep your immune system under control, then your vitamin D, which is helping to control that regulating mechanism, is like, it's like just being sucked right out of your system. And so I'm shocked if somebody walks in here and their vitamin D levels are high. And the first thing I usually say is, are you taking vitamin D? And they say yes. And I say, how much? And they usually say somewhere between like 6 and 10,000, because for that patient, it takes that much to get it up to, say, 50, which is where most of these people will be if they're taking it. Most of our patients are like 10, 11, 15, that type of stuff when they come in. So that's why we assess it in all of our patients. It is becoming more commonly assessed, I noticed, in the
medical world.
Yeah, in the records that we're getting before we see the patients, and we're seeing that more and more. And then they just say, you need vitamin D. And they say, well, why did they give it to you? And they go, well, I don't know. It was just low on the test. Right. So I guess in general, it's being understood, and that's good. But it would be nice to know why you're giving the person vitamin D, because a number of things can happen. You can actually, some folks can actually store vitamin D. We'll talk about that briefly. I haven't discovered yet whether you can overdose on it. I understand you can, and it can cause like muscular cramps and things of that nature. But I've taken an awful lot of vitamin D, and I haven't overdosed, which I'm not sure what that says about my system, but I've scaled back a little bit. We can chat about that a little bit too. Again, for those of you who haven't watched, the way we got into this is I have fibromyalgia, peripheral neuropathy, chronic fatigue, a balance and dizziness problems, had celiac, methylfolate, parasites. So I'm the experiment. On, yes. So it's and more. And I had one guy say, "You're full of crap." So I pulled out my file and I showed him, and he was like, "Oh my God, you have all that stuff." So I am kind of like the experiment here, and so. But again, we're gonna make a point on, for example, how much time you need to be outside for vitamin D, and what are all the factors that would be involved in it being enough for you, geographic locations and things like that. So how is it metabolized in the body?
So vitamin D is metabolized in a number of ways. I kind of went through that in terms of when you're out in the sun, your skin has basically a cholesterol derivative, the all-important cholesterol.
Another steroid.
Exactly. That's going to convert into basically vitamin D. So you're in the sun, it fires a mechanism that causes you to make precursors of vitamin D, and then those other precursors get converted into vitamin D in your bloodstream. Vitamin D then goes to your liver, and it has a biochemical step there. That's all I'll say. I won't get more specific. And then it also will go through your kidney, and there's another biochemical step in the kidney for proper vitamin D function. Also know that your vitamin D needs to be cleared out of your body so you can eliminate excess vitamin D also. And
so if you've got some of that, you're going to notice that when we start talking about the effects of vitamin D and where they're affected, you're going to notice that different parts of that pathway are affected.
Yeah, exactly.
Liver, kidneys, et cetera, et cetera, et cetera. So the way that vitamin D is processed from the time it hits the skin to the time the cholesterol, even low-fat diets probably affect vitamin D production.
One could raise the question.
We just surmise things here when we see this because it's just basic chemistry, you would think.
And then for those who cannot get out into the sun on a regular basis, or for those individuals that live at northern latitudes, especially during the winter, it's important for them to take oral vitamin D. So you can do that to bolster up your serum vitamin D levels. And vitamin D causes absorption of calcium from the gastrointestinal tract. It basically will mobilize calcium from the bone tissue. Hopefully all of that calcium floating in your bloodstream will lead to more bone tissue being laid down, or the adequate amounts of bone density being maintained. And that's how vitamin D is really discussed from a biochemistry perspective, and medical biochemistry, everything that every other doctor learns. That's the general diagram. But as we're going to go into now, we're really going to talk about the nuances of what we term the pleiotropic effects of vitamin D, as Dr. Rutherford loves me to say. And all that means is that vitamin D has a host of other effects in the body aside from bone metabolism. It has effects on your immune system, it has effects on depression, it has effects on type 2 diabetes. We're going to go into all of that now.
And just a teeny bit more, a lot of folks come in and say, well, but I've been outside. I've been outside, and I didn't get enough vitamin D. And Dr. Gates just touched on that a little bit. But there are so many factors. I've read you can be outside for 5 minutes or 10 minutes a day. Just stand out there, put your face up to the sun and get enough. And that probably is enough if you do it every day. I've read that if you have not been out in sun for as long as like 60 days, you can go out and spend half an hour out there, and in a week make up for it. So it's all over the place. But a lot of our patients have been out in the sun. And so, so latitude has to do with it, as Dr. Gates said prior to this presentation. He said, well, people up in Canada can run naked up there, and it's not going to matter because it's the way the angle of the sun, it's latitude and all these different types of things. So it's a little bit more complex. There's a band around the planet where if you're there and you get outside, it's going to work. There's 2 bands where good luck, you should be taking vitamin D. So it's kind of a general framework, okay, for that. However, what we see is that, and we're now about to get into the many pleiotropic effects, which is redundant, and this is why this is in that pathway, and this inconsistency in being able to be outside, period, or being outside and maybe not getting the sun is going to result in a lot of the things that we just got done talking about. So let's start with the immune cells, because that's what we do. I mean, everybody walks in here with chronic pain. It seems like they have an immune problem that they either knew that they had or had no clue that they had. And so let's start with that.
Well, with our immune system, as I kind of discussed with the Th1, Th2 sides of the immune system per se, the immune system first has to recognize a bacteria or virus, and that is largely involving what we term the innate immune system. So we just have an immune system that's ready to go to kill things. And vitamin D really helps that part of your immune system to function well. So when people are low on vitamin D, and this is one of the arguments as to why vitamin D status is so important in the wintertime, because that's when infections tend to be more common, is that you want to bolster up your vitamin D so that that part of your immune system, these aggressors, so to speak, can work well to kill these bacteria or viruses. And there's also some question now and some hypothesis that vitamin D may fire the immune cells involved in killing cancer as well. That research is early, it's not definitive, but that is also being asserted, just so you know, in the scientific publications.
And so you made a point prior to us getting on here. We were talking about cancer, and I have, like anybody else, looked at the internet, and the internet was clear that once you have cancer, then there's been no studies to show that it helps at all. Who knows? Studies are studies, and who knows whether they've been long enough, or who sponsored them, or all those types of things.
Or how much vitamin D was administered.
Ooh, big time.
That's the other question. And we did attach a study to today's broadcast where they showed that colorectal cancer patients, colon cancer patients basically, who took vitamin D had better responses than those not taking vitamin D.
Right.
But everything with vitamin D is not about waiting until you have a problem.
So that's where we were going.
And I'll probably hit bone mineral density next. But with vitamin D, especially relative to the immune system, and what they're talking about relative to vitamin D in terms of these immune cells that kill cancer, is that you want to bolster up vitamin D metabolism so that those immune cells really work well to increase your probability of not getting cancer. But again, for all of you out there, you need to understand that when they say there's no research, it doesn't mean there aren't scientific publications. It means when they do these randomized controlled clinical trials comparing breast cancer patients taking vitamin D versus those that are not, they're not seeing a difference. But again, questions of how much vitamin D are you taking, how severe are the breast cancer patients, there's a lot of variables that come into play for them to say there's no research. When you need to know there is a lot of research supporting vitamin D supplementation and testing. And a lot of the articles now are saying that's why physicians need to regularly check vitamin D status. But we've talked to a lot of doctors, and they'll just say, I don't know, vitamin D is low in everybody, so I just give it to them, but I don't really know what I'm doing. I mean, I've talked to a lot of doctors who say that.
What if somebody does take a lot of vitamin D and it starts causing symptoms?
Like what sort of symptoms? Oh, like they're feeling worse.
Yeah.
Well, you may have a vitamin D polymorphism, meaning genetically you may process vitamin D abnormally. We have one of these patients going right now. She was seeing a top endocrinologist in town, and he kept seeing that her vitamin D levels were off, kept seeing that her calcium and phosphate levels were off. You give her vitamin D metabolites, basically vitamin D medications, which theoretically was the right thing to do. But every time she would get dramatically worse. And we later found out that she has an abnormality in her kidney and how she processes vitamin D, and that is why. So if you take vitamin D and you feel worse, that's probably what's going on. Is that a common thing? I would say no, we don't see it a lot.
No.
There was a gentleman who was a fibromyalgia researcher and clinician who came out saying that every fibromyalgia patient needs to be assessed for this because he's seeing it. We have not seen that to be the case. This is the first one I've seen probably in 2 years.
You can store vitamin D?
You basically store an abnormal form of it because your kidney is not clearing it correctly.
And so that is unusual.
It correctly. Yeah.
When we were doing it in the beginning, I was actually testing everybody for that to see if they were studying this. There's a test to storing it, but it was so rare that I think the thing I wanted to bring out is as Dr. Gates said, most of our medical colleagues, they just know it's low. They don't know why it's low. And so they'll go by the lab test, which is good. But if the lab test says it's normal or it's still low and the patient is getting symptoms, this is where you have to stop. You have to stop treating by the lab test. And we do a lot of not treating by the lab test, okay? You have to stop treating by the lab test and you have to understand your symptoms. So if you are someone out there, now look, I'm embarrassed to say this, but you need to know, if I could do this, I'm sure other people could do this. We got a new vitamin D in, and I didn't realize that there were 10,000 unit capsules instead of 1,000 unit capsules. There was an extra 0 on there that I didn't see. So I had been taking 5,000 units of vitamin D a day. And 5,000 to 6,000 to 10,000 is not unusual in our office because we have people who really have low vitamin D. They have autoimmune systems going, sucking it out of them, and they need it. So I thought I was taking 5,000 to 6,000 a day. I was taking 50,000 to 60,000 a day for a long time by accident. And it was interesting, but there was like a virus that went through here last year.
We had 3. Like I mean, I was sick 3 times last year.
Yeah, and I think I was the only one in the office who didn't get sick last year. Now, I'm not telling you go out there and take 60,000 because the person who stores it is going to feel worse. Even worse at maybe 6,000 or 5,000 or 3,000. But I didn't feel anything. I just didn't get sick. And I have a lot of immunity issues. I don't know if that has anything to do with it. I have no idea what it is. And I spend some time out in the sun. I walk every day. I go golfing on the weekend. I walk, so I'm not riding around a little truck with a thing on top of me or anything like that. So I get a ton of sun. I was taking 60,000. So it's still up in the air as to what to do with this stuff. I'm not telling anybody out there to take 60,000. I took it by accident. I'm back down. I won't tell you what I'm back down to, but I'm back down. And so we're just trying to present to you, I know we can read on the internet, but this is still an open issue. I think vitamin D is a lot more valuable than a lot of people are aware of. Because when you look it up, it helps calcium, it helps osteoporosis. Some people will say it helps prevent cancer. They're usually very clear saying it doesn't help cancer once the person gets it. Those are things that I've read. So let's talk about some of the other interesting things, not unlike some of the other things that we treat. Epstein-Barr virus, different types of viruses and for chronic fatigue and things of that nature. Just because you have the virus in your system and it shows on a lab test doesn't mean it's your problem. You can look that up on one of our other hangouts, okay? But vitamin D has a similarity, especially when it comes to kids and HCV.
Yes.
Why don't you go with that? I think that's pretty cool.
Really interesting. So they looked at this population of children who had hepatitis C virus. Hepatitis C virus can be dangerous because it damages the liver, obviously, and then that can potentially lead to liver cancer down the line and other liver abnormalities. And what they found is that children who had good vitamin D status were actually able to, in large part, clear and keep the hepatitis C virus at bay, versus children who had lower vitamin D status were not able to do that and required more treatment than the high vitamin D status children. So very, very interesting data. We attached another article today looking at lower respiratory tract infections in children being hospitalized across the board. Those kids who are hospitalized for these lower respiratory tract infections, basically pneumonia, they had lower vitamin D status than kids who are not being hospitalized, who also had respiratory tract infections. So vitamin D, it's wintertime. Vitamin D needs to be assessed. You need to make sure your vitamin D levels are appropriate. In our office, we shoot for a vitamin D level of about 70 for our patients to have good function. And we do see a difference with that.
And you need to know our philosophy is not to walk out of our office with bags of supplements, okay? We think it's detrimental, at least to our patient population. If your immune system's working good, your stress mechanisms are cut down, your gut's better, your thyroid's good, You don't need all this stuff, okay? You need, but you need what you need, and it's difficult today to find out what it is. There's tests, there's this, there's that. So we're not a big one on taking bags of supplements as prevention. We're a big one on getting your body working so that you can assimilate the nutrients out of your food, which are still enough. Yeah, I get it that they're not as many as they used to be. We're still enough if your gut's working, if it's assimilating. And if you have enough vitamin D, it's probably one of the few things I'm comfortable saying you should take this preventatively. Especially, I mean, do a blood test. You know,
right.
obviously, do a blood test. But if you're not 50, you should be 50. You should be 50 or 70, maybe 50 to 75 at least, something like that. Yeah. So, I mean, that's our recommendation. It's one I feel okay about. I don't think you're going to go, but if you start taking it and you start feeling bad or you start getting cramps in your legs, stop. You may be one of these folks that store it. Okay.
Or you may just be overdosing too.
Or you may be overdosing.
Patients do that. They do that.
Yeah, okay. I'll refine that. If your tests are normal or low still, and you're getting those symptoms,
there you go.
Then stop.
Yeah.
Then stop taking it. Okay. So MS.
Yeah, MS is a big one. So vitamin D and the relationship to multiple sclerosis was talked about. I remember it around 2005. It may have been out there earlier. They started seeing these associations. There's a field called epidemiology, where they basically look at how common illnesses are or diseases are in different areas of the world or different areas of a country. And when they would look at the concentration of MS patients, they noticed that they were more at the northern latitudes or the southern latitudes per se. Well, the northern latitudes are really highlighted for the most part. So countries in Northern Europe, Canada, the higher states of the United States like Minnesota. And what they started wondering is, well, is vitamin D status lower in these MS patients, and is that potentially affecting the immune system, which is allowing the MS process to occur? And as we discussed, vitamin D regulates the immune system. For those of you out there who have MS or know someone with MS, MS is a Th1 dominant disorder. So that side of the Marine Corps that I was saying that does the rough and tough killing of the bacteria and viruses, that can get overreactive in MS patients and lead to the destruction of the fatty tissue around nerve cells in the brain and spinal cord, resulting in little scars, which are called plaques, resulting in multiple sclerosis. So they started seeing that vitamin D is low, so everybody hypothesized, well, maybe these MS patients need to take vitamin D. That didn't necessarily pan out to improve clinical outcomes, but they have shown that in childhood, the vitamin D levels are really important in terms of your risk of later developing multiple sclerosis if you are genetically predisposed. Now, they have further identified that multiple sclerosis patients lots of times can have abnormal genetics relative to how they process vitamin D. So they may not, the vitamin D may not activate their immune system correctly, they may not absorb vitamin D well, and they may not clear vitamin D from their circulation in an appropriate fashion. So that can also result in, when they're low in vitamin D, and then they're genetically not processing it well either, now they're really in a bad situation where their vitamin D function is very, very low in their body. And that can result in their immune system getting out of balance and therefore resulting in the MS process.
And I think it would be legitimate to postulate from that. Again, this is kind of what we do every day. We treat autoimmune patients, lupus, where people come in with lupus, people come in with MS, we have people who come in with Crohn's disease and celiac and Hashimoto's thyroiditis and all these things that are, all these conditions that are, I think it would be legitimate to postulate that there may be some consistency among those findings that you just said with these other, particularly the neurological diseases. Now, it's not there yet, but we tend to see things kind of postulated because we'll do certain things, we'll see people get better, and then 5 or 6 years later, it'll be in the literature. So clinical kind of precedes research because that's where research gets their ideas from. They don't just like look under a microscope and go, oh, maybe this would be like good. Well, sometimes they do.
So there's a disorder that we've talked about in a lot of broadcasts called Hashimoto's thyroiditis, where the immune system kills the thyroid gland.
There you go.
Named after Dr. Hashimoto Hakuro. And with Hashimoto's thyroiditis, we've been managing vitamin D levels relative to that for, like Dr. Rutherford was saying, 7 years now, for me, 6 years. And we just saw a study a couple of weeks ago that came out in just the last few months where they showed that the lower the vitamin D levels are in circulation, the higher probability someone is of having Hashimoto's thyroiditis, and the more severe the disease will be. So these new findings are coming out every day. And as you said, lots of these things are just basic biochemistry. For the most part, the rules will always apply. Sometimes there are exceptions. Sometimes the biochemistry doesn't apply. But we're seeing it with Hashimoto's, we're seeing it with MS, and we're probably going to see associations in the future with rheumatoid arthritis and lupus and all the other.
So if you have an autoimmune
diseases.
problem and you haven't looked into your vitamin D levels, I would do so. Okay, I mean, I think it would be, we're very careful, even though I seem cavalier sometimes. It's the inner New Jersey in me, I think. But this is not cavalier. I mean, in essence, in general, again, I'm a little hesitant because we have a very specific patient population that comes in here, but it would probably be wise to check your vitamin D levels, because again, we're emphasizing it as a preventative. And if your vitamin D levels are low, there are probably a plethora. There are probably many reasons that we don't even know about right now why your vitamin D levels need to be in that 50, 55, 60, 70 range. I would just go with that because it's not dangerous. If your vitamin D, if you start taking vitamin D, you start getting aches, you go back and retest it and your vitamin D levels are still low, just stop taking it. You're just one of those very unusual people. But now let's just step back for a second because we got some other fun stuff here Dr. Gates dug up. Let's just go back for a second. I'm sure people are going, well, what about vitamin D and osteoporosis and bone density? And what about vitamin D and depression? Because those are the ones people come in and say, oh, I took vitamin D and my depression was good for a while. And then it wasn't. But
yeah, with depression, they've shown seasonal affective disorder very common, even in areas like where we live, because the sun will start setting around 4 o'clock and after Thanksgiving through the end of January. And when we get less sunlight, it can affect the brain deleteriously. We know that there are vitamin D receptors in the brain, and it can have an effect on depression. And so a lot of people take vitamin D, especially I can't imagine living in Portland or Seattle, those northern latitudes with a lot of rain, Holland. And people notice that if they go into like tanning beds, they'll feel better, or if they just take oral supplements of vitamin D, they'll feel better also. Or we have a friend who's a psychiatrist, and he recently went to Iceland, and they have shown that the Icelandic people have a genetic not necessarily abnormality, we call it a polymorphism. So their genetics are a little different, such that they're resistant to seasonal affective disorder. Wow. Because they're so used to being at that northern climate that everybody is just genetically resistant to being in the dark and having depression. So I found that pretty
and
cool.
That goes back to it's where you live. You live in the sun, you need vitamin D. You don't live in the sun, the body somehow, with its innate intelligence or innate ability to, over long periods of time, can adapt. A lot of what we're seeing in this office in chronic pain is the body's inability to adapt to everything that we're throwing at it right now, relative to highly stressful lifestyles, poor diets, not sleeping enough, staying up too late, getting up too early, too many drugs. Not anti-drug, but I mean, when you come in here and I got a list of 15 drugs in front of me, I don't have to look at them. That's too many drugs. And your pharmacist would tell you the same thing. And the American College of Pharmacology, I think, has a term for when you're taking more than 3 drugs. It's like called polypharmacy, something like that. And with the bottom line, that's pretty cool. Because again, it goes to, this is where we are, this is what we got to do. But your bodies can adapt or go through significant maladaptation. And our bodies are in maladaptation right now. That's basically what we do, is kind of get people's bodies back to balance and back to adapting properly. But how about the
osteoporosis?
Bone, yeah, the osteoporosis, because this is one I get all the time. It's slightly more involved than what you might think. I don't know that we're going to go into all the mechanisms of osteoporosis, but I mean, we have people with osteoporosis get better when we fix their gut. But people's osteoporosis get better when we fix their thyroid. We won't get into all of that, but
you know, the whole thing with osteoporosis is it's just like everything with our current healthcare system. We wait till the last minute to start addressing it. You got to address osteoporosis before the age of 30, pretty much. I mean, that's what the current statistics show. That's when you basically hit your bone density peak. From there on out, you're basically losing bone.
Seems like every female walks in who is 25 or above, who's 25 or above, who is taking a bone density test, is osteopenic.
A lot of them are, and
meaning I think you're on your way.
I think a lot of it is our vitamin D status, our nutrition, and especially our physical activity level. If you kind of look at how we were designed to grow up, we're designed to lift things, we're designed to be out there, we're designed to, basically be in the elements. And a lot of human beings at this point are not. A lot of us live kind of pseudo-sedentary lives. We don't lift weights, we don't lift heavy objects. And so those are factors that can lead to decreased bone mineral density. And then everybody starts worrying about it at the age of 50. And at that point, you're basically just trying to hold on to whatever bone density you have and lose less of it through time. And it's a really, really major problem, especially if you have good genetics and you're going to live a long time. So with bone mineral density, everybody says take vitamin D, take calcium. They've basically shown that taking vitamin D and calcium, taking vitamin D by itself or taking calcium by itself, does not exert a significant effect on reducing fractures. So if you fall, you're pretty much just as likely to fracture. There are some nuances in that, but
so you need to take drugs.
That's basically it. So yeah, and then that's the argument for you need to take these bone density medications like Fosamax, not targeting Fosamax, that's just the one that's commonly used, to help with these problems. Again, addressing the issue on the wrong end. We really hope it gets out that, females especially, because they tend to be more effective with osteoporosis, start doing vigorous kind of plyometric or weight training exercises are very good in a controlled fashion via a skilled professional, so to speak, and making sure your vitamin D status is appropriate. That's your best chance with your calcium levels for having good bone mineral density going forward. And
there's just a ton of factors in that, okay? But that's a baseline. Mm-hmm. That's a baseline vitamin D. And he's not saying got to go kill yourself because of all, I've always been pretty active in my life and I mean, there were days I would go to the gym for 3 hours. I don't do that anymore. I walk, I do some light calisthenics, I do some stretching, I walk the golf course, I swing a golf club. It works. You don't have to go out there and be pounding the weights.
But you do push-ups, you do pull-ups, you do squats.
Yeah, but I don't do anything like I used to. I mean, I do 25 push-ups. I used to, do multiple sets until I would do, I used to do lots and lots and lots and lots of sit-ups and stuff like that. The point being that, yes, you need to do the exercise, but I don't want them to get the idea, because if they get the idea, I got to go get a personal trainer, now I'm going to go and do all that stuff. Most of you probably a moderate level of strengthening would be sufficient. And taking your vitamin D, and for those of you in our climates, walk out in the sun during the summer. Go find a place to take a walk once a day for 30 minutes. It's probably the best thing you can do for your entire physiology is to take a walk. We should do a whole thing on taking a walk and what it does for you. It's like amazing. Mm-hmm. We are human beings. We are meant to walk. We're not necessarily meant to run marathons or triathlons, but we are meant to walk. So how about blood sugar? I find that interesting.
Yeah,
how does vitamin D positively affect blood sugar? Because it does hypoglycemic, reactive hypoglycemic.
And this is probably what we'll conclude on. I mean, basically, we have a lot of research here, and we can go many different directions.
I think we hit
the main things. Well,
that in the lungs?
Yeah, that's good. So with the
this is fun.
with the vitamin D, relative to type 2 diabetes mellitus or mellitus, however you want to say it, they've shown that taking vitamin D can lower fasting glucose levels in diabetic patients, which is pretty interesting. Now, what they're finding is that the adipose tissue, so type 2 diabetics tend to have more fat around their waistline. We term it adiposity, and that adipose tissue affects vitamin D metabolism. Basically, it decreases it. So when you give a type 2 diabetic vitamin D supplementation, it improves their glucose control. We're now seeing that taking vitamin D can affect hypertension, it can affect cardiovascular disease, it can affect a host of different problems. It can affect the lungs. We're seeing that asthma patients and COPD patients can be helped through vitamin D supplementation. Kidney disease patients can be helped through vitamin D supplementation. The thoughts on basically all of this is that it's affecting inflammation.
Right.
So vitamin D brings down inflammation. There's inflammatory pathways associated with diabetes. There are inflammatory pathways associated with chronic asthma, chronic obstructive pulmonary disease known as COPD, as well as even chronic kidney disease. Can have definitely an inflammatory component to it.
Yes, and that's it. That's really where it's at. It affects the immune system positively. It affects inflammation positively. You can have 100 different people come in here with an autoimmune problem and or general inflammatory issues. And those inflammatory issues can affect different parts of the intestines, different parts of the colon, different structures. What's the lung? I mean, really, asthma is like inflammation of the little cells in the lung called alveoli. Bronchitis is inflammation of the inside of the tubes. It's inflammation. All of a sudden, you start treating somebody for a bad gut, you get their inflammation down. Next thing you know, their asthma is better. Okay, I mean, we see, particularly the athletic asthma, we see it all the time. So again, one of the strengths of functional medicine was and I had a great, I spoke at great length about this with a patient yesterday who had the targeted, she had 100 things wrong, okay? She didn't have 100 things wrong. She had a significant, and she acknowledged stressful life that had put her in a post-traumatic stress syndrome. She had positive tests at hand for at least one autoimmune problem as I thumbed through it. She had Hashimoto's for sure. And we didn't examine her yet. I just did the consult. She's probably inflamed all over the place based on the symptoms that she had. So when you start looking at the global systemic problems, I mean, it's those of you who've drank a noni juice or whatever all those juices are, and you feel better for a while, and then you got to keep taking it, but there's still a lot of other things going on. You know, you're quenching the inflammation. You do a fast, you feel better. I mean, I would feel better if I never ate again as long as I live. When I don't eat, I feel great because there's nothing in my system being irritated. Okay, but I eat somewhat meagerly, and I feel better. You know, that's how I get from that, because it's calming down the inflammation. This is big about your immune system. This is big about inflammatory responses. A lot of what we're talking about, a lot of biochemical mechanisms are downstream from calming down that immune system and from calming down those inflammatory mechanisms. Mm-hmm. But I would say that for someone who does not like to take supplements, someone who doesn't like to take drugs, I do take one thyroid medication because I need to take it. We've done all the stuff we can do, and I was still profoundly tired. I am not any longer. But I would say that preventatively, if I had to tell a person to take one thing preventatively, I'd say go get your vitamin D checked. If it's not right, take it. If you're taking it and you feel worse and you recheck it and you're still low, stop taking it. That's, as Dr. Gates says, very, very, very unusual. But
if you're taking it, get your vitamin D levels checked again, because you may not be taking enough or you may be taking too much. Taking too much is a rarity, but frequently patients are taking 2,000 IUs a day, and it's just not enough.
Yeah. Oh yeah. Yeah, it's way not enough. Yeah. So, I mean, that's the takeaway. We think it's something really important, enough to, enough to contribute a whole hour or however long we've been gabbing away here to this. And we hope that answers some of your questions, kind of broadens your scope on it, maybe clears up some things on the wow, why has everybody got vitamin D low, and so on and so forth. So, any comments? We're open to comments. We have had to stop taking questions, individual questions. We have ways on our website that if you want to access us or you want to get a consultation, we do consultations at a fee now because we can only do so many. But we do a real consultation. If you send us all your stuff, we actually look at it. People are shocked that they send us this much stuff, and we've actually reviewed it before we talk to them and things of that nature. But anything else, you can look at powerhealthtalk.com. And we have probably, I don't know, how many hours now? Probably 225, 230, 240 hours or something like that online. We have a lot of hours online, okay? Okay. I'm not the specific guy that Dr. Gates is, but we have a lot of hours online. And pretty much everything we talk about, anything we mentioned here today, we probably have a half an hour to an hour online. If you want to research it further, just go to the powerhealthtalk.com and then go on the Hangouts and then just scroll down until you see one that catches your fancy. We have tons of stuff on there. So until next week, thank you for looking. Did I miss anything?
I don't think so.
Okay.
I think we're good.
We'll come up, hopefully. He'll come up, hopefully, with another good topic for next week.
Well, today was your topic, so
yeah,
I drew from your list, so this was good.
Okay.
All right. Well, thank you for watching.
From there. All right. Bye.